and welcome. You're watching Coronavirus Facts versus Myths. I'm Rishika Barwa. The news that is just coming in India. Well, are we all set to get our first single-dose vaccine? Johnson & Johnson has applied for emergency use authorization of its single-dose COVID-19 vaccine. They've applied for emergency use permission with the Drug Controller General of India. Johnson & Johnson, remember, is collaborating with Biological E for the supply of this vaccine in India. It is a single-shot vaccine and the efficacy of this vaccine is around 85%. Let's quickly get a reaction from Dr. Arvinder Singh Soin, Chairman of the Institute of Liver Transplantation, joining us from the Medanta Hospital. Thanks very much, Dr. Soin, for being with us. Your first reaction to the news that is just coming in, J&J applying for emergency use authorization of a single-dose vaccine.
Well, that's encouraging news. Any news that suggests that there'll be more vaccines for us is good. So I hope we can give them EUA and have enough J&J vaccine supply. It's obviously a convenient vaccine to use because it's only single dose. So we are waiting with fingers crossed, and hopefully this will happen soon.
Well, it is indeed encouraging, and when the approval process does happen, India will be getting its first single-shot vaccine, which will definitely boost our vaccination efforts. But I want to now shift our focus, while we are talking about the emergency use authorization of perhaps India's first single-dose vaccine. A global third wave is already there. It's being seen all over the world. It's being attributed largely to the spread of the more dangerous and rapidly transmissible Delta variant. Now, in order to combat the surge, to prevent severe disease, a booster shot, a third dose of a COVID vaccine is in fact being considered. Apart from Israel, Germany, France, UK have said that they might actually start giving a booster shot to the public. Now, India, along with many other developing countries, still has a very long way to go. Less than 8% of our population has received both doses of the COVID-19 vaccine, and at this rate, at our current rate of vaccination, only 34% of our population will actually be vaccinated by the end of the year. So this is a very interesting development that's taken place. And keeping in mind the vaccine inequality that we're seeing around the World Health Organization has actually called for a moratorium on this third dose plan till at least the end of September. The World Health Organization has asked countries to halt booster shots to favor the unvaccinated. They've said that booster shots should be halted at least till September end. According to the World Health Organization, in high-income group countries, 50 in 100 people is vaccinated, as opposed to low-income group countries where 1.5 in 100 is vaccinated. But moving on from the data, what does this really mean for vaccine-induced immunity? How long does vaccine-induced immunity last? Are we really protected against COVID if we have just 2 shots, and that too taken 6 months ago? To answer some of those questions, of course, Dr. Arvinder Soin is with us, but we're also joined by Professor Sanjeev Krishna. He's a professor of molecular parasitology and medicine from the St. George's University in London. Thank you both very much once again. Professor Krishna, if I can begin by asking you, the UK is considering giving a booster shot. A final decision is going to be taken. The US is considering it. Israel's already started doing it. Several other countries doing it. What does this essentially tell us? Are those of us vaccinated more than 6 months ago not protected against COVID?
Thanks for having me, Rishika. This is work that is being looked at very, very much as we're making the decisions in the next few weeks. And the latest information, because Israel started fairly early vaccinating with the Pfizer vaccines, suggests that actually vaccine immunity is not waning, as much as some people might imagine. And my work has always been in low and middle income countries on neglected diseases. And I have to say, I'm very much in agreement with the strong statement made by the Director General of the World Health Organization on vaccine inequity. we really must get these vaccines out to as many people across the globe as possible. And if we're going to even consider boosting, and it's a fair question to ask, if people are not protected well, how should we do this? And I think it should be done intelligently, because there will be vulnerable populations, people who've had bone marrow transplants, for example, or who are immunosuppressed, in whom this couldn't be necessarily even a boost. It could be a third shot to actually get a vaccine response. But in other cases, we really do need to get the vaccines out to as many people as possible.
Okay. Dr. Soin, where does that leave countries like India?
So, Rishika, the third and fourth waves across the world are the waves of the unvaccinated and waves of the Delta variant. These two facts are indisputable facts with which everyone agrees. So, if you look at it globally, then before countries and people that have had 2 shots go on to take the third shot, it was only logical, not just from equity point of view, but also scientifically. If you want population immunity, if you want 60 or 70% of the world to be vaccinated so that the pandemic can actually go away, then it stands to reason that those vaccines which are lying extra in these countries should be given or donated to vaccine poor countries. I wouldn't just say developing or poor countries. I would say vaccine poor countries should get the vaccines from the vaccine rich countries. So that's how it makes sense. Otherwise, the pandemic doesn't really go away.
But
if it just goes
Dr.
in the
Soin,
US or UK, then what use is it? People can't travel.
No, I understand what you're saying, but I want to go beyond the data, because the data we're putting out the information of which countries are considering the booster shot, and we're also putting out data in terms of what is the full vaccine coverage in these countries, what percentage of population is already fully vaccinated, that data as well. But what does this tell us, Dr. Soin, about vaccine-induced immunity? In India, for instance, healthcare workers, frontline workers who were double vaccinated 6 months ago, are they not protected against the Delta strain?
Well, unfortunately, Vishika, we don't have enough data. No real world data exists on whether doubly vaccinated people will get breakthrough infections or severe infections, especially, or die after 6 to 12 months. There is no real world data with us, and I don't think anywhere else in the world, that proves that doubly vaccinated people are actually suffering because of not having the third shot. What data is available is that the antibody levels become lower after 3 to 6 months, depending on the immunity status of the person. So transplant recipients or people who are otherwise immunosuppressed will not display enough antibody level or as much as non-immunosuppressed people do, but that's not real evidence of protection. I mean, there is T-cell immunity, there is memory cells, and there are no clear lab tests or data to measure that. So we don't know if people are actually suffering after 6 months of having 2 vaccine doses.
Several countries across the world are now giving a third shot of the coronavirus vaccine to their vulnerable population. Where does this leave us? Where does this leave India? And are those people who got the vaccine 6 months ago not protected against COVID anymore? So we're looking to answer some of those questions. There are some countries that are giving a booster shot of the mRNA vaccine, preferring to give a booster shot of the mRNA vaccine. Some countries that are actually giving a booster shot only to those who were vaccinated with Sinopharm. What do we make of this?
Well, once again, we're in the process of collecting important information, because sometimes particular vaccines aren't easily available back in a country, and at other times, as more information comes out about vaccine A compared to vaccine B, for example, there may be reasons to prefer B rather than A. And we need to really study this mix and match approach and to see how well this mixing results and delivers the antibodies that are being looked at, bearing in mind what was said before by the previous speaker, that there aren't great correlates of protection, but what we can measure, we should measure. And that's where, intelligent testing to look for the need for repeated vaccinations also comes in for the booster question.
What's the best way to deal with the future waves, Professor Krishna? Do we need to better protect the vulnerable population in order to bring down hospitalizations? Or do we need a more equitable approach where we vaccinate at least with one shot as many people in the world as we can in order to further, prevent mutations, variants from emerging? What's the better strategy?
It's a very hard question to answer to everyone's satisfaction, that one. We need to expand our vaccine coverage. I look at it, as I've said before, that, we're in a global village. And if a house is on fire, Delta is taking off in a country, you can try and put the fire out in that country, but actually it's going to catch in your neighbor's house. And unless you help, all the countries around the world keeping these fires low, that fire, the neighbor's fire, is going to come back and set your house alight again. So
right.
you have to look at it like a village. And that's what COVID has done for us.
It's very important what you say. And it once again underscores the idea that no one is protected unless everyone is protected. But Dr. Soin, I'd like to come back to you, because what about frontline workers, healthcare workers, our first line of defense against COVID? We need them to be protected. We need them to be guarded. Do countries, therefore, need to think about a booster shot, at least for the frontline and healthcare workers?
The data we do have on the need for third shots is in immunosuppressed patients. So liver transplant, kidney transplant, bone marrow transplant, other transplant patients, people who are immunosuppressed, who are elderly, who have otherwise high risk due to comorbidity. So those are the people who may not develop enough antibody levels, or whose antibody levels wane. And since that's the best measure for protection at the moment, yes, those are the people that can be considered first for the third shots. And that includes healthcare workers too. But I have no reason to believe that the healthcare workers will be any different from the normal population in terms of the duration of protection. So I think healthcare workers will be protected for 6 to 12 months. So there is this caveat when you are considering healthcare workers who are healthy. But people who are high risk should probably be the first in line for the third shot.
All right. People who are high risk should be first in line for the third shot. More data is still needed. And it is a trick question on whether to give a booster shot to the vulnerable or more vaccination coverage across the world. No correct answers there. Professor Krishna and Dr. Soin, thank you very much for joining us on this important conversation, a story we'll continue to track very closely. Well, one of the countries which is actually giving out the booster shot is Germany. This despite the fact that the World Health Organization has asked countries for a moratorium on a booster shot, saying that more countries need more vaccines. But let's get a reaction on what really is happening in Germany at the moment. We have William Glucroft of DW joining us. Thanks very much, William, for being with us. What's the latest with the booster shots in Germany? We know that Israel's approved a third shot for 60 plus and actually started rolling it out as well.
Well, countries all around the world are asking themselves, are booster shots needed? And if so, when and for whom? That has been decided here in Germany, and Germany joins a very small list so far of countries such as the United Kingdom and Israel to provide booster shots for people over 60 and for people who are at certain risk groups, certain health conditions. Those will be starting in September. That's what Health Minister Jens Spahn, the federal health minister here in Germany, said this week in agreement with state-level health ministers. Now remember, it's the states that will actually be responsible here in Germany for getting those new vaccinations, that third round of vaccinations, into people's arms. And some states are concerned that they just don't have the logistics, they don't have the supply chains, they don't have the people to make this a smooth operation, especially when there are many people still getting their first and second shots here in Germany. But health officials are convinced a third round of shots are necessary for older people, for people with conditions, and they're needed now, or should I say in the coming week starting in September.
Very interesting. Is there really logistical support there for that booster shot in countries like Germany? William Glucroft, thanks very much for joining us with the very latest. We're going to slip into a very short break, but on the other side, we look to answer all your questions on the coronavirus vaccine. Stay with us. Welcome back. On to our special campaign, Vaccinate India, in partnership with Google. We're discussing questions you may have about the coronavirus vaccine. And to answer some of those questions, Dr. Yatin Mehta, Chairman of the Medanta Institute of Critical Care, joins us. Thanks very much, Dr. Mehta, for being with us. Critical questions over vaccine immunity have now emerged, with several countries considering the booster shot of the coronavirus vaccine. But I want to come back to the basics. How long does it take to develop immunity, firstly, after you've been vaccinated?
See, normally after the first shot of vaccine, there would be about 40-50% protection. And after the second shot, depending on whichever vaccine you have taken, it will reach whatever 80%, or some of them claim to be 90% immunity. So it takes a few weeks for the body to start reacting to the thing. So I would expect that after the first shot, about a fortnight or so, you will start getting some immunity.
Right. And how long does the vaccine immunity last? Because with countries now looking to give a booster shot, there are many questions that are being asked on whether people who were vaccinated 6 months ago are still protected.
Rishika, these are all ongoing studies which the results are not out. So your guess is as good as mine. Booster shot may help, but how long the immunity lasts and when should the booster shot be given are questions still unanswered. Some of the countries are giving booster shots, yes, although WHO has recommended it to have a moratorium on it.
Yes.
Because WHO is looking at a global view of healthcare for all, while those other countries are looking at their own citizens for their own protection. They are not looking at the world as such. So there is a question of supply and demand and who can afford and who cannot. So at the moment, the booster shot is for primarily immunocompromised patients.
Are there parameters on the basis of which vaccine immunity can be studied or gauged in the elderly, vulnerable populations in order to understand better about vaccine immunity?
Yeah, see, one of the simplest things to do is measuring the antibody levels. So antibody, either neutralizing antibodies is what normally tells you of how strong the immunity is. The cellular immunity also, now some papers have come out that even if the antibody levels are not very high, the T-cell immunity will come into picture and protect you. So those things are still unanswered. But yes, at the moment what we have is antibody level measurements.
Right. I also want to ask you about mRNA vaccines. How are mRNA vaccines different and how do mRNA vaccines work?
No, see, this messenger RNA is, again, these are some of the technologies are new technologies, which have not been tested earlier, first time tested in COVID. So there, some of them are vector carriers. That means the dead virus or some part of the virus is introduced to the body through the adenovirus, which is called a vector, and which enters the cell and produces antibodies. It is non-replicating virus, so it does not reproduce, it does not grow. So the risk of the patient getting the viral infection is non-existent because of all these.
Right. Many viewers have asked questions about whether one technology is superior to another, whether one vaccine is superior to another. Are mRNA vaccines better than, say, the two vaccines that are available here in India, the adenovirus or the viral vector vaccine?
See, now these questions are again difficult to answer actually. Some of the technologies like the Pfizer technology is a completely new technology, which was unproven earlier. But yes, I mean, we Indians by and large believe that whatever is in the West is better than what is there in the Indian scenario. Otherwise, if you look at your indigenous so-called vaccine, which is a Covaxin, it has showed better immunity against Delta variant. So initially people were resistant to take it. Now people are asking for Covaxin rather than Covishield. So I don't know.
All right. So so in a certain sense, whichever vaccine is available to you is the best
Take
vaccine for you.
Whichever you get, just take it.
All right. Well, on that note, we'll wrap up. Thanks so much, Doctor, for joining us.
Thank you, Rishi.